Hello everyone, my name is Iman. Welcome to my YouTube channel. As you can tell from the title of this video, today's topic will revolve around health, which is my health, your health, everyone's health, and the healthcare system that serves to meet our needs here in the United States. We have quite a bit to discuss, so without any further delay, let's get into it. First, I would like to introduce myself and the credentials I possess, as this may help you understand my perspective on and views on certain social issues. I am a licensed registered nurse. I'm also a public health nurse. I'm a certified personal trainer and soon to be certified nutrition coach. I work full-time, which is 40 hours a week here in the United States. And honestly, I could not possibly add any more to my plate at the moment. However, I have such deep passion for educating people about health and wellness that I have decided to carve out some time out of my free time to be doing videos like this, so that anybody out there could get assistance from it. If there's any legacy I would like to leave behind, is to have a society that has woken up to realize the power and control that they possess over their health and their lives. Anyone who knows me will attest to this fact. I completely understand that not everyone will want to hear or agree with the contents of this video, which is completely understandable. You are entitled to your opinions, and I would love to hear them in the comments below. My intention on this platform is 100% to educate and empower you to be in charge of your health. Whenever you feel ready is when you can start to be active in your wellness journey. Remember that whether you do decide to start exercising or not as part of your health improvement plan, neither path is easy. So I ask you to exercise your freedom of will wisely. The information I will share with you in this video is relayed in the lens of a public health nurse, a bedside nurse, a clinical research nurse, a daughter, a mother, sister, friend, neighbor, and a coworker. We as American people have reached a point where we have all accepted the status quo of our healthcare system, either because we are happy with it or unhappy but feel helpless to change it. If you are the latter, then you and I are on the same page. I have come to realize that attempting to change the healthcare industry or healthcare system, which represents a huge portion of powerful insurance and pharmaceutical companies, not to mention public health policies that have been put in place for decades to allow for these issues to fester, is next to impossible. The other simpler, single most powerful option is to change our habits, your habits, in the context of improving health. If I had a magic wand, I would wish for a preventive health specialty that will adhere to educating on health promotion. Annual checkups are great for catching disease, but what if we could include an additional part, which is educating people to stay healthy? Small changes such as controlling your meal portions, walking outdoors, maintaining appropriate BMI is impactful in reducing cardiovascular and metabolic diseases such as coronary artery disease, type 2 diabetes, hypertension. Recent study from University of North Carolina showed that 88% of American people suffer from metabolic challenges. Some of you may be thinking this is way too high, but it is not too far off when you look at the current obesity rates and statistically accommodating for the margin of error. The term metabolic challenges in this case is inclusive of all people who have received any metabolic disease diagnosis, plus those who are at high risk of developing the metabolic diseases, and also those who have the disease but are yet to be diagnosed. For example, many people walk around with undiagnosed diabetes, prediabetes, hypertension, prehypertension, high cholesterol, and even coronary artery disease. With such high obesity rates in US, I'm going out on a limb here and say that statistics on the 88% of American people being metabolically challenged is highly accurate. Now, most people don't just get a standalone metabolic disease such as diabetes. Of course not. They come together as a package. Since your system, your body works together. Now, that's not a good package. These become the primary disease on top of all other secondary disease that individual may succumb to, which increases the morbidity and mortality of that individual. It is unfortunate and very predictable that our children and even our pets will succumb to these very diseases that is afflicting American adults. This healthcare crisis is just the tip of the iceberg and is overwhelming for our society as a whole, especially for the doctors or the primary care providers who have to treat the patients. The doctor can only do so much for that patient, and also what's within the scope of practice and training and resources allocated to him or her. Based on my professional background, here is my solution and why I'm utilizing this platform to do my part to help alleviate this crisis. You also must do your own by either listening, accepting this information, and applying it. But again, no one is in control of you applying it except you. The message here is take care of your health. It may sound like such a cliche, but it is true, and it's the only thing you can do to help yourself and your loved ones. Fortunately, most of these metabolic diseases respond very well to lifestyle changes such as weight loss, nutritious diet, and building and maintaining a healthy network of community. Therefore, educate and empower yourselves about exercise, nutrition, and partnering with your primary care provider. On this channel, I promise to do my very best to research the most scientifically sound and unbiased health and nutrition information and share them with you on ways to improve your health by eating right and exercising consistently. I really hope you found this video to be helpful, informative, and also relatable. If so, please like the channel, subscribe to the channel, and this is going to help the video's algorithm improve so that people who find it helpful can share. Thank you so very much, and I wish you a happy Christmas Eve, and stay warm. See you next time. Bye-bye.